In sex therapy, the process is very similar to other kinds of talk therapy. Typically, a sex therapist will start with an evaluation where they will ask questions and maybe have patients complete some questionnaires and then take that information and develop a treatment plan specifically for that individual.
And speaking of treatment plan, basically the focus is on the particular sexual concern that the individual or couple comes in with, but also often there are issues of anxiety, depression, there may be relationship problems that need to be addressed too, and those will all become part of the treatment.
Exactly, yeah. And we also give homework exercises for patients to do in the privacy of their own home, either individually or with couples. We also do a lot of educating. It's lots of questions that need to be addressed. That's very helpful to talk about in therapy.
And in terms of, what do we mean by homework? What we say in sex therapy is that what couples do outside of the therapy office is just as important, sometimes more important. And so what we may be suggesting are individual things to do, like particular reading that could be helpful, or relaxation exercises, or with the couple, they may be working on improving their communication. The sex therapist is giving specific guidelines of what to talk about, how to do that differently. And then on the more physical side, there is a very common set of exercises known as Sensate Focus, which we often will recommend. And this is a step-by-step series of basically massage exercises that a couple does, where the focus is on reducing expectation, that there's no particular goal or outcome that's necessary of this, but really to focus on what their body is feeling.
Sure, yeah. And I often have patients ask, and I think you do too, what exactly goes on in session? Will there be any touching in session?
And that's really important, I think, is to emphasize that there is no sexual activity that happens in the therapy room.